Assalamualaikum and good afternoon everyone. So I see you again in our tutorial YouTube class. Yeah, with the pandemic now we have to do our class in YouTube because at least you can repeat the video from time to time, and even during sleep or not during sleep, sorry, while you are waiting to sleep, so you can watch the YouTube, or even though you are practicing, so if you don't get clear the way of doing correctly, so you can use the YouTube to guide you. So okay, I just want to share with you about what we have done on 6-minute walking test. I think everyone clear about my video, but if you notice at the end of the video, I have no time to explain because it's very long video, so I make it half of the video now. So the second half of the video is basically to continue from where I stopped. So if you notice that I don't talk about what is the main outcome from the test, because you know the 6-minute walking test is about the distance covered by the person. So we use the distance here as measurement or outcome measurement, so then we can indicate whether the person having a good cardiorespiratory endurance outcomes. So if you want to know that the 6-minute walking test is designed basically for elderly population, you know, a person who are very frail, as well as a person who have cardiovascular heart problems or cardiovascular disease problems like heart failure and so on. So I've been stressed this so many times in our lesson, in our class, that every VO2 max test is designed for specific population. It's not applicable to everyone. So it depends on the main and what is the objective of testing the person. So because that 6-minute walking test is easier and also very preferable for disease population, okay? Because you know, when someone have cardiovascular disease or cardiorespiratory disease, meaning that they have less ability on moving like normal people, so they are very sedentary usually, because that is part of the risk factor. Some of them are elderly, so the 6-minute walking test is designed for that type of population. Okay, as I mentioned earlier about 6-minute walking test, we try to obtain the most important outcome is the distance covered by the person. We don't take heart rate as our prediction, because in 6-minute walking test, it's not the same like other sub-maximal tests using like Astram bike or using a different level of intensity where we want to find the steady state heart rate. But in this test, we purely take the distance covered by the person. So meaning that if the person who have a less distance covered while walking in 6 minutes, so it gives the impression that their cardiorespiratory endurance are very poor. So yeah, it makes sense when your heart is not strong, so definitely the heart cannot produce a lot of oxygen supply to the whole body, especially on the distal region of the body. For example, like your feet, your calf, your quadricep, which is all this is a major muscles that require a lot of oxygen. So if you have your heart capacity are not so good condition, so definitely the blood supply to this region will be shorter or will be lesser. So let's come back to what is the outcome in this test. The outcome of this test is the distance that the person will cover. So I will share to you about, there are not many research using 6-minute walking test for the norms, but basically I have 3 references that they have tested about. Not they are tested, basically they get observation on different type of elderly population, as well as the person who are having heart disease problem. So they took the test and then they percentile the test according to the age of the individuals. So if you, I'll share with you, maybe you can see in the video that, okay, for example, like we have 3 studies that putting 6-minute walking test into norm. First study is Brown's et al., where they use this to measure the frail elder participants. So meaning that they want to see how the distance covered by this elderly, which is very frail. Frail means so weak. Okay. So what they found that if you see in the video, I will paste now. The age range from 60 to 69. So they found out that the males covered of the distance in their mean is 498 meters. Okay. And then the females about 405 meters. So for the when the age is go up or increase, like they put that in every 10 years difference. So the range between 70 to 79 years old, the male have less distance a little bit. So it's a 475 meter covered, and female is about 406 meter covered. Just not much different for female. And then for 80 to 89 years old, for male, you will see that the numbers of course will reduce. It makes sense that elderly, like our grandpa, grandma, they at this age sometimes they cannot walk. And for us, we take this study from Europe, so most of the time the lifespan of European people are higher, especially country like Italy and so on. The elderly population have a long lifespan because the government has put a lot of programs to ensure that the numbers of people survive in their lifespan every year, meaning that it's no longer a premature death. If you are in the age of elderly, so they put a lot of program to ensure that the survival for this elderly population will increase. Okay, that's why you can see that at age 80, they put some observation that 80 to 89 years old, the numbers of distance covered by female is by male is 320 meters, and female is about 282 meters. But this is no assistant. Okay, it's very rare case to have that. Very rare case to have that. For those who have assist device, definitely the distance covered will be less, which is 197. And person who have no assistive device, there will be range about 328 for male and female. And that is studied by Lusardi. Okay. Brown study, they found out that the distance covered among 84, the mean age of 84 years old, frail elder participant is about 264 meters distance covered. This is the mean of the participants that they cover the distance. Okay. Stefan in 2002, they found out that the distance a little bit higher. Okay, from age of 60 to 69, a little bit higher, more than 100 meters compared to study by Lusardi. Okay, so maybe you can go through the table. So the most important here is not about you are comparing to them, but you give you some guideline. So if you test a person who have cardiorespiratory problems, so definitely the VO2 max is low. So when the VO2 max is low, the distance covered will be decreasing. So if the person have less than 200 meters distance covered during 6-minute walking test at the age of 30 years old, meaning that they are actually have a similar distance covered people with 84 years old, has been reported in Brown study. So from here you can tell to the most important here is how you tell your client, because we do not want ask them to do the test with us and then you have some moment that you cannot explain to them in the simple word, in the simple terms. Because our job, yeah, we have to follow evidence-based practice while performing the assessment. But the most important is not just on your part. The most important is how you sharing and how you educate and how you tell your patient or your participants in a simple way where they can understand much clearer what they are doing this, because they have a right, okay? They have the right to know what exactly the test is all about and then how they have to perform the test. Because it's very easy. If they understand, then the job becomes easier, because the test become more meaningful, because the person that you're testing know what they are doing. So what you can explain here is try to explain that if you have more distance covered than 400 meters in 6 minutes, meaning that your capacity of the heart considered still okay, or not just optimal, we can say it's still okay, because we don't have the best range of superior, intermediate, and so on. Because what we are doing is more a relative cardiorespiratory fitness test, because we don't take any heart rate. The heart rate that we use before and after, the heart rate that we use before, during, and after is to give us more guideline, okay? If the person who are taking beta blockers, how you can manage them in the safety way, because we need to ensure that we follow the law, and at the same time the person who doing the test are safe to complete the test. So I will like to see in the coming weeks or in coming days that everyone should practice this. Try to explain, do not to the participant using a simple terms, okay, in their language, but not in your language, because I afraid I know that you know a lot of things, but the know a lot of things for you is good. The most important is how can you simplify your understanding or your knowledge to your participant or to your subject, because they have also the right to do the test with their own understanding that okay, why I'm doing this test. Because remember one thing, we need to find a way to put ourselves into the client's shoes, because that is their right when they volunteer to be the subject or to participate in the test. So we need to have some understanding that, or consideration that they have to know what they are doing, and when they know, so I think the knowledge that you want to put here are much more useful for them, because we do not want something that we learn in the lab, only we understand that, because it's important, yes, that you know, but remember that you are treating people using exercise, so they also need to know what you are doing, because you cannot keep them all the time, or you cannot supervise them all the time. So the way that you sharing your knowledge or the information in easier way is actually can enhance your assessment towards the patient. So I would like to say thank you so much. So I see you in the coming tutorial. Okay guys, good luck, all the best.